Okay, good morning everyone. Today we meet again in the Meta Journal Hour 13 with our topic. Very interesting topic, I guess. But before we start further, I would like to invite Prof. Chu to say something about our MGH today.
Okay, for those who have just joined us for this Meta Journal Hour, it is an online journal club that we are trying to organize on a monthly basis. So it is actually meant to learn how people conducted their research and how we can do better if that is possible. Yeah, and also after that, we will learn from the findings whether the findings can help us to improve whatever we are doing. So today you can see on the screen, we have Puan Sawana Ahmad, who is going to share with us her reading on this paper. And it's something that all of us, especially those doing research or funders or institutions who are keen in conducting training researcher would actually find this paper the kind of business that NIH is also doing, how we can assess impact from research that is funded, and how an institution can prioritize research projects, research endeavors, and lastly, how to find research gaps. And to me, I would actually, in my training, we would actually start from research question, isn't it? Research questions, and then we would then refine our research questions by doing literature review to make sure that we find the gaps or whether it's a groundbreaking research, and then only we proceed further because that is our motivation. That's the reason for us to plan and to do a research, because any new research would easily take up our 2 years, 3 years time, and for that kind of amount of effort and time, you really want to do something that's important, that's really necessary. Yeah, so from a trainer perspective, that's all that I think I'm doing. But for a higher level of institutions, they have to have some way. They have to have some way to assess their funded research and whether their funded research has any impact. Has any impact to the target user, target community, and what sort, all that kind of outcomes lah. And also, this paper is interesting in that manner that how is that a proven way? Is that a proven way when an institution want to see the prioritization of applications, and is there a proven way to assess the research gap in future? In this paper, you see that they actually assess their funded project in the 10 Malaysia plan. So in the past 5 years, and they try to prepare for the next 5 years, the 11 Malaysia plan. So we will try to understand how this is being done in NIH, and what did they do? What did they do to improve their priority setting, and also to make sure the research gap is there before they kind of approve a research proposal. Okay, I think that's all from me. Can you hear me clearly? Because I'm not actually hearing myself clearly. Is it okay, yeah?
Putus, Prof, in between.
Oh, sorry for that. So I think I've said all. I pass over back to you, Sawana.
Okay, all right. I think Prof. Chu have summarized the study all about, but before we go further on that, I would like to introduce the writer, the author of this project. It's actually a group of research from NIH and MOH, which they did assessment on the research project that they funded in the NIH. So before we go further, we go to the background of the study. So actually, this study was done by a group of researchers from NIH, and some of them are from Ministry of Health. So they want to establish initiative. They are aligned with national health priorities, and also they want to give effort and address gap between research they funded and that action and policy that can be addressed in the study. So before they go for the health research priority setting, HRPS, they has established of health research priority setting, HRPS, in the Malaysia plan, 10 Malaysia plan between 2011 and 2015, where from there they identified and prioritized the research area cluster, which are 6 of them: health system, healthy lifestyle, empowerment, burden of disease, health technology, and sustainable environment. And from there, they classify all of the research under 5 domains, come from the WHO domains, under the WHO framework, which there are 5 domains. There are health, finances, and economic, governance, health information, human resource for health, and service delivery. And based on the 10 Malaysia plan, they identified all the research cluster and put them in 5 domains, and they are looking further to assess for their UAQH, that is Universal Access of Quality Healthcare cluster, and they want to put it in 11 Malaysia plan under health research priority. So what is actually health research priority setting? Is actually a process that they want to optimize the impact of health system research investment, and it is also a process of setting healthcare research priority, which they believe that it can improve efficiency of research fund utilization and reduce duplication, especially when researchers accept same project and do redundancy of finding produce result for research. Also, they want a country could identify the health research needed in a transparent and systematic way. And last but not least, they want to align research initiative to current needs, especially for Malaysia setting. So based on the 10 Malaysian plan, they want to find gap. What are the gaps that can give impact and implication of research, especially in supporting informed decision and policy making in Malaysia. So what they have known, actually, there are research open data, the number of report, publication and presentation produced were collected, but they found issues and gap in between, which the research impact assessment was not done based on that, and it's also challenging due to the lack of systematic approaches to evaluate the research impact, especially on the health policy and practice. So what's available currently, there are few research impact assessment which are established in the UK, in Australia, there are payback framework, UK Research Excellence Framework, and also the Baker's Medical Library Model. So in this study, they use the payback framework from Buxton and Haney, which they try to overcome the gap and the issues, so which they can highlight in the 11 Malaysia plan under the research cluster. So this framework actually define the research impact into 5 categories, which are knowledge production, benefit to future research and research use, informing policy and product development, health and health sector benefit, as well as broader economic benefit. And also this framework also address the conceptual issue, and it's being used as a tool to help funder and stakeholder to collect, analyze, and report data consistently to capture the research impact and output. Later on, we will go on this framework. So they put the main objective, the general objective is to assess the impact of funded. All right. The main or the general aim from the study is to assess the impact of funded prioritized research from NIH, which they give fund to the researchers under them to improve future HRPS setting and research fund allocation. specifically project in under NIH and MOH only. So there are 3 tools that has been used by these authors of the study. Number 1 is payback framework to assess the impact of research project. Number 2 is the CHNRI, which they adopt from Rudens 2008 for the identification and determination of research priority areas. And the last one is to find the research gap by using relevant conceptual framework. So in this case, they use the WHO framework. Okay, what they found in their data administrative from NIH, under their cluster UAQH, they found 71 projects, but they only include 67 projects because it was funded by NIH, but out of 65, only 50 projects included in this study because the rest 70 projects are still ongoing. So this project is actually under the 10 Malaysia plan, and they become a cluster for the UAQH for 11 Malaysia plan. So this is the summary actually, when you can see this one is the framework by the WHO that the author used. 5 domains here is 5 domains are the government, the health, economic, HE, human resource for health, information and technology, service delivery. If you are missing something, if you miss the information somewhere in between, so just get along with me because we'll go one by one by the objective. So as I mentioned just now, the number included project is 67, but for the evaluation analysis, they only use 50. 50 project. So evaluation and analysis is based on 3 other objectives. Number 1 is to evaluate the research funding and impact. Number 2 is the health research priority setting and process. And number 3 is research gap identification. This is the summary of the objective. So we will go one by one. Okay, objective number 1 is to assess the impact of funded prioritized research to improve the HRPS and research fund allocation. Here it involved the 5 domains and at the same time the stakeholder feedback. So purpose of this objective using the payback framework is to address conceptual issues, to help the funder and stakeholder evaluate possible impact research, and to collect, analyze and report data consistently to capture research impact and output. So we'll go for the first part is methodology. The first part is the author tried to identify under UAQH based on the 5 domain WHO framework, which they did already at the first stages of the project. There are 5, as I mentioned before this. So number 2, what they did is actually distribute 2,145 questionnaire to the participant from their workshop. 200 is person stakeholders that attended their workshop, and 45 was emailed by online who did not attend the workshop. So stakeholder consists of the researchers, decision maker, healthcare provider, research funder, academician from government and private sector. Okay, and then the distribution of research fund, what it means here is the research fund allocated for the researcher from NIH was analyzed based on this domain. So they categorize all the research project into 5 domains here. So later on we will see the result. This one is the first part of the objective 1, and the second part of the objective 1 was they used the payback framework to assess the impact of the project, the impact of the research project. So actually in the framework there are 5 impact criteria that are listed in the original paper by the Buxton, adapted by the Kwan et al. So this study by NIH, they adapted by the Kwan, adapted the framework by Kwan, but actually there are 5 categories, but the authors of the study only focus on 3. So based on these 3, actually the researcher derive or produce their own criteria to assess their project research. So what comes under the knowledge production were 4 items, which are publication, report, research highlight and presentation under knowledge production. And under policy, it comes into fund awarded, low, either is low, medium and high based on this allocation. and versus policymaker engagement. So they wanted to see either the funded research project would have any engagement with the policymaker. Later on we will see on that. And number 3, under health and health sector benefit, they would like to see the appropriateness of intervention, quality of care, health system delivery, epidemiology, cost effectiveness, and improve effectiveness of policy, public health policy. So for this one, there were no explanation how they derive of this criteria, but this is what I believe is from the authors' consensus with their project team. So they produced the criteria. So the details of it, I'm not very sure about that. So the outcome from this objective one, they would like to see the stakeholder perspective and as their expectation versus 5 domain. They would like to see, each project, how much project that were classified into each of the 5 domain. So the impact category of benefit to 5 domains. So that's the outcome. So okay, let's see the result from there. 5 domain identified from the framework, WHO framework and stakeholder survey. They give the among the 5 research domain, the distribution of research fund between the actual fund allocated and stakeholder expectation. So they found that the lowest allocation was for the IT, information and technology, that were 4.6%, while for the highest is actually for the service delivery, is 33.5, so 29 project out of 67 project. So the result is likely due to the number of research projects in their respective domain. So if you can see from the result here, the highest is SD and HE, but the lowest is the IT. And then the 10 MP fund allocation, the highest is SD, following by HE. But from the feedback from the stakeholder expectation, they hope for the 11 MP, the fund allocation will be given higher for the SD service delivery. So it's quite similar as compared to the 10 MP fund allocation. So any comments so far? Do you want to ask something about this result? Maybe you don't understand well, or you have some opinion? Anyone? No comments so far?
Perhaps, Samana, would you have any comment on why they research this stakeholders survey on the expectation of the research funds? It looks like they want to hear the stakeholders. These stakeholders here are those PI and member of the research teams. Am I right? And why is it important they want to survey the expectation of the fund? Is there any reason they give in the paper?
Actually, this is not from the PI. This is from the funder, the academician, the other party, not the PI. So they would like to, to get their opinion. Either they get the same, similar, fund allocation with the expectation. Although in the paper it mentioned that it's actually contradict, because the stakeholder expectation was for other domain. I forgot about that. But the allocation and the stakeholder expectation for this study become quite similar between 10 and 11. So at first, the stakeholder expect, during the MP 10, the funder plan to give the higher allocation for other domain, but from this study they found that is aligned together from the 10 MP with the stakeholder expectation for the study. Do you get that, Prof?
So they were asking, first, do you have any information on these stakeholders? Who are these? Who are they?
If we refer back to the slide, the stakeholder is actually the researchers, decision maker, healthcare provider, research funder, and academician from government and private sector attending their workshop or planning
Okay.
workshop for the 11 Malaysian plan. So it
Okay.
consists of various people from, maybe different background, and then what's their expectation for the fund allocation versus the real allocation for 11 Malaysia Plan research grant.
Would you be able to make out the reason why they want to do this survey on stakeholder expectation for future fund allocation? Is there any reason for that?
In the paper, I'm not sure, but what I can see as a overall, they wanted to prioritize which research area or which research domains that are important for the funders, at the same time for the researchers to focus on and has good impact for future planning, especially for Malaysia healthcare and policy. That's the things I can see from the paper.
I would like to invite audience to give your comment. I'm not so sure about what you think, but I think if you ask whoever, they will always say their field of research or their field of interest is, require or, need more fund. If you ask every single different expert or specialist, they will say, oh, my field need more fund, my field need more fund. So it will depends who you survey, isn't it? If you survey all pediatrician, then we will get all the response from the pediatrician that pediatric field need more funding. If you ask more all the orthopedic surgeon, the orthopedic surgeon, oh, my field also need more funding. So how are they going to make use of the survey findings? I really couldn't think of the purpose of that and how are they going to use the survey findings. Is there a reason given in the paper? Or is there anyone who would like to say something about this? If you ask very few person from the IT, then they will say very few about IT things lah. If you don't ask anyone from general practice, then you will not get feedback, on the needs in primary care or GP practice, isn't it? So you get likely to get a biased result depending on who you ask.
I think what's
Isn't it?
missing here, Prof, if they produce or put the list of the research categories, maybe we can look further. Which project, which area actually dominant, which area actually were missing in between.
No, my point is this survey and the purpose of this survey is going to be decided by the types of respondents, isn't it?
Yeah.
You ask expectation of, because the responses is likely to be weighted or biased by the type of respondents the survey sent the questionnaire to. I do not know what they are trying to get to from this survey, because if you ask different people, they will give their own expectations. They will not give a fair expectation. If you ask me, I will not be able or be fair to other discipline. I can only be able to tell you, if my research interest in diabetes, diabetes need a lot of funding lah, that kind of thing, right? I will not know about cardiology or not know about respiratory one.
Yes.
So it's really depending on the type of respondents the survey send their questionnaire to. So in this respect, I do not know how to make use of the finding from this survey. I don't know what the purpose of this survey in that sense.
Do you know, Prof, anyone in this floor, do you know any of the framework or the methods that, can make use of this, Prof? I mean, the best way, the best method to assess this?
I do not know the purpose of this survey in the first place. Why you want to ask about expectations?
All right.
If you leave it to me, I'm not the expert in administration, in administrative, all these things. But if you want to allocate the fund, then you need to first. I think I'll stop for a while. They're very noisy here.
Okay, it's okay. Any comments from the floor? If there are no comments, then I will go for the objective 2. Sorry, objective 1 still have some result here I missed. Okay. Okay, just now we see the result for objective 1, research funding impact, and if you still remember, there are section 2, which they use the key informant interview payback framework, so which they modified from the Kwan et al. Payback framework and also the Canadian Institute of Health Research, and they mentioned, the authors mentioned that the response rate was 100% from the stakeholders. Of the 550 completed projects, the 36 and 11 and 18 supported decision and policy making. So out of the 50 projects they reviewed, only 18 projects supported decision and policy making. Remember, they are the red words that I focused just now: the knowledge production, the policy, and the health benefit. So from there, 11 supported decision and policy making. Another 30 reported to have policymaker engagement, have no or lack or have real engagement with the policymaker. And they reported from the study that 2 projects in the lowest tertile reported with no policymaker engagement, as we can see in table 2. So from here, they try to see from the fund awarded to the researcher which project has no policy engagement or has some process or methods led to the policy maker engagement, or the project actually supported or very related to decision and policy making. So if you can see, fund awarded, the lowest with no policy maker engagement was 2 projects, and 11 project led to policy maker engagement, and 4 has research supported decision and policy making. This one is based on the research funding and impact. Any question or comments for this part?
If I may also chip in, thank you, Sawana, for this slide. I think this is very important about engagement. For those who are in UPM, if you have applied to Putra grants, you also know that in the application form, there's one section or one item, you have to say something about engagement, policy maker or industry engagement. So engagement is something that we want a research to be able to be, have wider influences or impact. But coming back to this paper, someone, would you be able to share how is this engagement being measured?
They use the payback framework, and then they use the questionnaire additional. Sorry, this one is 2. And they use actually the questionnaire, from the payback framework. Can I share the questionnaire, Prof?
Oh, yes, please. So in research, we all want to know how an outcome is being measured and who were the respondents. Yeah, remember the research question of PCO. We always want to know who is the P and how is the or being measured. Yeah, then only we can have a meaningful understanding and interpretation.
Okay, this is actually the questionnaire developed by the researcher themselves.
I don't see. We don't see it. Maybe you have to unshare and share again.
Okay, again, sorry. Okay, can you see?
Yes, yes.
Okay, this one is actually the questionnaire developed by the researchers. By the authors of the paper, the researchers, I mean from the NIH. They adapted from the payback framework. So the framework actually just give you guidelines how you develop your questionnaire. So this is come from the researcher themselves. So which they derive the criteria or the items in the questionnaire based on their study objective. So here, if you can see from the result just now, have we seen this? Not yet, right? So they put the output like publication, report, research highlight, and presentation. So actually this result we will be seeing in our next slide actually. So this is the questionnaire they asked to the PI to get the feedback on the knowledge impact on the policy. So just now we see on the policy. Here is the policy. It's actually the researcher will rate their project by themselves. How is their project has any knowledge impact in terms of these itemized, or if their project has any impact on the policy or decision making or any gaps, so they need to rate their project by themselves. So it's been answered by the researcher, the PI.
So it's self-report lah.
Self-report, yes.
Is there any verification mechanism in the paper?
Not mentioned in the paper. So I'm not sure how they come out. How they derive the items and all of the criteria in this questionnaire. I'm not sure.
It's okay.
Yeah.
Now we know the items or the question they asked the PI, the researcher of the funded project. After they have received the report from the PI and researcher, was there any verification from the NIH or from the study team to ensure the responses or the feedback here in this form by the PI or the researcher were correct?
Not mentioned in the paper.
Not mentioned. Okay, so we have to take it as, have to believe the the self-report lah. So the paper does not seem to tell us whether there's any verification being done. Okay.
Yeah. Okay, just now we just see the result. Actually, the result was, put not in sequence. We see the policy and product development as first result, but we have another two, knowledge production and health benefit. So just now, this one done. Okay, this one also done, right? And for the knowledge production, as we see in the questionnaire, they derive from the knowledge production, publication, report, research highlight, and presentation. They only classifying of the research project based on the type of the research project. The type of the knowledge production, or journals or reports, or reports from the research. They classify into the domains. WHO domains, and if you can see here, 148 presentation was produced, another 33 reports, 22 research highlight, and 8 publication produced. So what I can say here is actually it's quite low number of journal publication, but they have high number of reports and presentations. So maybe it is common in NIH and MOH to produce report rather than publication. And also, the evaluation impact under the category of benefit to health and health sector show that 36 project expected to see impact related to quality of care, while 17 expected health system delivery benefit. So from the other side of the criteria, on the benefit to health and health sector. The highest are the quality of care and healthcare system delivery. So this one is
Okay.
based, yeah,
So Anna, maybe
yeah.
also it's important to understand how is this so-called 36 projects were expected to see an impact. How is this expectation of the project could be true? Is there any way that they mentioned in the paper?
No other supportive, statement or evidence saying to support this, Prof. I didn't find anything to support this, Prof. It's just one statement saying that, yeah.
Okay, this result was from self-report, is it?
Yeah, from the PI self-report, from the questionnaire that we saw just now.
Okay.
So, okay, the statement about 36 project expected to see impact, there is no other statement, to support this apa ni dipanggil this evaluation of impact. Yeah, it's just one sentence of statement. So I
Okay.
cannot tell more. Yeah,
For the benefits to health and health sector, right?
yeah.
How they differentiate between the appropriateness intervention, quality of care, hospital service, and epidemiology? How they know which one is which one actually?
I'm not sure about that, Dr. Zifa, because it's not mentioned in the paper. Yeah,
Mm.
yeah.
Uh, do you prepare the questionnaire as well? I mean, is it the questionnaire that also they attach an additional file as when they ask the key informant here of the project? How did they ask about these benefits to health and health sector?
They didn't mention anything, Prof. The details of, explanation or definition of each words, here. No, they
It's
didn't
not
mention
given the
that.
paper, yeah?
Yeah, yeah, no.
Is
And
it the
they,
team is by the researcher or by the PI? The team for each one of these.
I'm not sure. It's not mentioned clearly, so I'm afraid if I'm saying something, so it will lead to, it's confusing. So I'm not sure
Mm.
about it. Yeah, it's not mentioned. Who do
Okay,
the
so
assessment,
it's
who
not
do
clear.
who derive the criteria is not mentioned in the paper.
I mean, how did they ask? How did they collect? How did they collect? How did they collect information on this from the researcher?
As I mentioned, they delivered the questionnaire hard copy during their workshop, and for the rest they delivered through online
Okay.
setting like emails. Yeah,
Is there a questionnaire attached to this paper or
yeah.
this?
Just now I show you. Do you want to see again
Perhaps see again.
the same paper? The
No, it
key,
will be a lesson to all of us if we are doing a
the same
survey.
one. Yeah, the
The
same
same one
paper.
that you showed just now.
Yeah. The first part is about the knowledge production. This one, publication, report, research highlight, and presentation. The second part was about the policy, and this one only for the gaps. And
Macam
then
mana
if you
kita
can,
orang tak
yeah.
nampak apa tu
Oh,
nama
sorry.
ya.
Oh, sorry. Okay. Again, this questionnaire it consists of three parts. The first part is the knowledge production. Right. The second part was on the question on the policy engagement with the policymaker engagement. The third part is the gaps, and you can see here there are the list of the benefit to health and health sector. They only state 5 or 6 these criteria, but they didn't mention clearly how they how they assess the quality of care, epidemiology, cost effectiveness. So I'm not sure how the PI assess this one. I'm not sure. Maybe they are being given, during the workshop. I'm not sure. Maybe they are, verbally explained, but in the paper they didn't mention anything about this in details. Like this one for policy maker engagement, also no details, explanation how how much, in what ways or what type of engagement, they didn't mention that.
Okay. Thank you, Savannah. So I think it's a lesson to all. We cannot assume our respondent understand our questionnaire, or maybe NIH, when they did the survey, perhaps there's a document explaining all these terms. Without explaining all these terms, whatever survey that we are getting is not going to be helpful and meaningful of the findings, because respondents may answer according to their understanding, and their understanding may differ among them, and the result that you get will not be meaningful. So it's very worrisome if that kind of questionnaire has been sent, and respondent, though they may be experienced researcher, but still they may be different in their understanding, and they may answer it differently based on their so-called standard. When the standard is not set the same for all respondents, result will not be the same, and then we cannot be analyzing them meaningfully. Okay.
Yeah. Anyone from the floor can comment on this? Maybe you have some information or basic knowledge on the framework, the payback framework. Anyone? No? Okay. If no comments, then I'll go to the objective 2, section 1. There are 2 sections. Number 2 is they want to identify and identify and determination of research priority areas from the same project, from the 67 research project. So the purpose is they want to put the stakeholder value to the criteria, and from there they try to score the research gap and calculating final score for initial prioritization. So there are 3 steps actually here. So from there, they will revise all of the weighting and scoring to prioritize which area could be included in the 11 Malaysia plan. So in this section, they use and adapt the CHNRI, Child Health and Nutrition Research Initiative, which they included 3 criteria, which they also developed the criteria based on their study objective. So the researcher from the NIH need to develop that. So the CHNRI by Rudin et al. Actually give guideline how this researcher should do their research. So from there, the researcher from NIH gave 3 criteria: answerability, feasibility, number 2, importance, potential impact, and number 3, magnitude or severity. So the method they use were, they will ask the stakeholder to put weighting value through questionnaire. So all of this actually, this section actually tell you about the criteria only. For the weighting score, we will see on the next slide. So for this question, after they got 3 criteria, so they will ask the stakeholder to answer 3 questions each, which is chosen based on the applicability period used in HRPS setting, and it's been discussed from the project teams, which I'm not sure which project teams they refer to, either the research project PI or the stakeholder. I'm not sure which one this. So the outcome were the 3 criteria that has been used in the stakeholder value instrument and research gap assessment. Alright, so this is where the questionnaire that consists of 3 criteria been used. So they put the stakeholder values through the application of weight. So from these 3 questionnaire, they sent over to 285 participants during their workshop, NIH Research Week and a research priority setting workshop. So this questionnaire, we will look into it later. So what they did actually, what they asked the stakeholder to do is actually scoring these criteria. So they need to put, some monetary allocation value as weight for the criteria to rank the research area. So the amount allocated to the criteria reflect the importance. So what the stakeholder needs to do is actually to put the allocating money, maximum 100 ringgit across the 3 criteria, and this criteria will give the information which one is importance by the ranking. So the outcome stakeholder value will rank among these 3 criteria. So I think the best if we see the questionnaire first. Okay, you can see this, right? This one is the question asked to the stakeholder about their opinions, value of the based on the three criteria, which the maximum is 100. So they need to give based on the project. So which one is important to them? So they need to put it in ranking. So if you can see here, there are three. Either the project is answerable, has the answerability, or it is important, or it has more magnitude. So based on the three developed criteria by the by the team of the project. By the NIH researcher, not the team of the project. Anyone to comment or ask something? Or better we see the result too?
Yeah, agree. Show the result and then we can discuss.
Okay. Okay, from this is the result from the questionnaire. So you can see that 63% who answered the questionnaire were the researchers and academicians. So that's the stakeholder. 16% were decision maker. 20% were the healthcare provider and others. Majority were from MOH, while the remaining were from the public, private, university, and other ministry. And they have more than 3 years of experience, and they put the higher value on the answerability and importance rather than magnitude that are presented in table 4. So I'm not sure why they ask all of these stakeholders to answer this. Either it give any information or valuable information, I'm not sure. But if you can see that the answerability and the importance, they have 34.69 and 34. So if these two are higher as compared to the magnitude, what I can say here, actually the criteria, the out of 150 respondents, only 151 answered the questionnaire, and respondents with missing data were excluded from the analysis. There's no other information about the missing data, why, the reason they are missing. And from here, they compared these three criteria using a statistical analysis. One Wilcoxon study rank, which they get this p-value, which 0.894 and 0.948, and the magnitude is 0.013. They didn't elaborate more about the p-value result here, but so I'm not sure how actually this information will give us, additional impact in terms of, knowledge for this study to improve. I'm not sure. So maybe someone can help me, since it's not mentioned in the paper, maybe someone can tell something about this p-value. Maybe Dr. Azifah or some of the participants.
Hi, Kak Sawana and Fortune.
Yeah.
So, first of all, I did not understand why they use one sample with constant sign rank test. Because one sample with constant sign rank test is basically for parametric data, and they didn't show and even tell us the normality result of the sample. And the sample size is quite large, which is 150 respondents. And if a large sample size is basically, they can use once limit theorem, which basically if the largest sample size, which is more than 100, they can use just a parametric testing data. Okay, so for one sample with constant sign rank test, it's basically we need to understand the null hypothesis and also the alternative hypothesis. And we want to know whether there is a mean difference of 0 or mean difference is not 0 to understand how to interpret the p-value. If we can see here, the difference between mean and median here is not really large. It's basically very little, which around 1 or 2 only, which could be the distribution of data could be abnormal. So we can see that the p-value here is less than 0.005. So if it's less than 0.005 means that the null hypothesis is not able to be rejected. However, we cannot infer anything from this p-value. That's a problem with one sample with constant sign rank test because you cannot compare between the answerability, importance, and magnitude. Which one is better from which one? Okay?
Okay, doctor. In this, in other words, are you saying that if the researcher used the 150 respondents, the survey, we can produce other result, better result other than this?
Actually, I need to see
Based on
whether
the
the data.
questionnaire. Yeah, based on the
Yeah,
questionnaire. Yeah.
based on. Sorry, Kak Sawana, I didn't get your question actually.
Yeah, actually from the questionnaire, they got, response from 150 respondents. Are you
Yeah.
saying that we can use this response, to produce better results?
Because the data is a continuous variable actually, and the data is quite large, 150. So actually, they can use central limit theorems.
Okay, all right.
Central limit theorem is basically will accept the data because we believe that when the data is larger, it will goes into a normal distribution. So I hope actually the researcher can write something on the normality value. I mean, why
Okay,
they choose this data. Okay,
okay,
because it seems like I need to guess why they're using this.
okay. Supposedly it should be there, right? For us
Yeah,
to
yeah, yeah.
understand and try
And
to,
they should
yeah.
mention why they use this, and they
Mm,
should give some comment how to interpret the p-value here. And
okay.
just saying that the higher value on answerable and important, I assume they take it from the means because the mean for answerability is higher compared to
Yeah,
others.
yes, yes. All right. So has missing information, right, to me. And from Dr. Zifa's comment, I found that it is better for, for the researcher to put the p-value explanation for us to digest more, to understand more, right? So any comments, Prof. Chu or the rest? Do you have anything to ask or comment? No? So if no, we proceed to the objective 3, where they try to find the research gap identification based on the relevant conceptual framework. So here they try to score the research gap based on the health research priority areas of the 10 MP, National and Global Health Plan. So they review all the research project under the 10 MP to identify national level research need for 11 Malaysia plan. So what they did, actually, in the workshop, they discussed and interviewed the stakeholders, the same stakeholders as listed here. So they will, from there, they have the research group where they conducted to identify research gap and with the use of the conceptual framework to guide them. So the conceptual framework that has been used in the study is the WHO. If you still remember the 5 domain. So from there, the researcher from the team were asked to answer the scoring of each research area or gap, which each of that will be awarded points with 0 with the disagreement, with 0.5 neither agreement or no disagreement, or 1 agreements. So the analysis was done where the research gap were grouped according to the domains of the WHO framework. So the result were presented as no tables or no, no tables presented, but it's just a list of a comprehensive list of research gap for UAQH. Later on we will see on the result. Also, they produce complete prioritized area for UAQH health research document, which they publish in the as the 11 Malaysia Plan under the Sararats et al. 2018. So what stated in the papers is that the list of priority area for each domain comprised of new and ongoing UAQH issues, research scope, research subdomain, gaps and needs with the associated rationale. New research area include transparency in health planning and delivery process, readiness, utilization of IT, as well as transparency and sustainable in health financing. Actually, for this result, I cannot comment much because I'm not so sure how they come out in detail, about the topics, rank, and the area they prioritize for the UAQH in 11 Malaysia Plan. So we will see for the result for here.
While Savannah is getting prepared, I may want to say something about the second objective and third objective. For many of us as researcher, individual researcher, we really also want to know how the funders, how the policymaker is assessing or criteria they look into when they want to prioritize research funding. So those that Savannah has shown, the 3 criteria in the second objective, and the research gap now in the third objective, what are the criteria they look into? So for researcher like us in the audience, you want to pay some attention to that criteria. Like the second objective, there's 3 criteria shown, right? I hope the paper is clear, or maybe Savannah can supplement the explanation of the 3 criteria. What is that? Answerability, feasibility, and what are the other one?
Health and health benefit.
Okay, so the criteria are those clearly NIH have zoomed in and decided to wait, They want to include the other stakeholders' feedback when they prioritizing the applications processing. So you want to have some idea when you're proposing a new research, whether your research proposal would be seen as of high priority or not. Yeah, so that's the trick here.
All right. Okay, we proceed. As we can see here is actually the only examples of research priority areas and research gap under UAQH produced by the objective number 3. So what we can see here, the domain are there, 5 domain here, as I mentioned previously, but the other column here, research scope, subdomain, gaps and needs, suggested research area, expected output, was not explained clearly in the paper, how they derive, how they come up with this, this list and so on. So what I understand is based on the workshop, they sit together and they have their research group. I think they discuss on the items and so on, so they come with this from the discussion. But other than that, I'm not sure how they did the process, how they come up with the table and so on. So this one is just example. If you go to the reports by the Sararats et al. 2018, if I'm not mistaken, you can see a long list of the research priority areas and the research gap. So it's just that it's not mentioned clearly in the paper how they come up with the list, Any comments from here for the objective 3? So maybe we can see some of the research scope they have here is for the governance is health planning, subdomain transparency. So the gaps here they put is lack of transparency is associated with poor participation of public in healthcare. This could inhibit citizens' effort in giving voice to public to hold health system accountable. So they suggest research areas such transparency in health planning and delivery process to promote and ensure the participation of public. Also, the expected output is to approach strategies that foster system design. Actually, I'm not very clear about all of this. I do not know what it means, and it is hard for me to digest actually. So maybe people from the health or public health background may understand better. Maybe can anyone, comments and give feedback on this one?
We
Yeah.
can actually learn the process
Yeah.
of them coming to identifying the research gaps. We do not need to see the
Oh,
specific suggested area,
okay.
but we can learn how NIH come through to identify the gaps,
All
and
right. Okay.
whether this process NIH use is something that we can emulate, or whether we can do something else better than that lah, that kind of
Okay.
thing.
All right.
So you see here the process of them getting to the research gaps. Is it something that you admire, or is it something that you think no, there's a better way of doing that?
I'm not sure, Prof, because maybe it is new field for me, and I have problem to digest and understand well, all of the process. So maybe I need to study more, read more about it. Yeah. So for me, it's hard for me. I maybe choose for as if there is or there are other ways, easier or simpler ways to do it, then I will choose that.
No, for all of us as researcher, we also want to know whether we are doing a new research in a gap, so that we can fill a gap. Whenever you can convince others, and especially the funders, that you are doing a new research to fill in some gap, yeah, so then you're likely to get the grant or more competitive grant. So here, the process of them getting to the gap, you can see the first column is a domain. So first we want to know how they come to this domain, and then how under each domain, the scopes are identified. There are more than one scope within each domain,
Yeah.
then subdomains, and then they give some rationale to that gaps and needs. That's all. If we believe the process they use is good, then we can emulate lah, individually level as well as at the institutional level. So our MJH can criticize that from Sawana perspective.
I'm not really sure, Prof.
Okay.
I'm not really sure. Yeah.
So as you said, I think the process wasn't clearly described as well, isn't it, in the paper?
Sorry again, Prof.
Is it because the process isn't well described in the paper?
Actually, they have a flow, to portray the process or the methods. But I found that it is better, to put everything in detail so that other people, other researchers can, replicate your study, your process, so that it can be reproducible, can be used by others. So following by this, I will say that I will not 100% follow, because I need some additional information to support my decision either to use or not to use, these examples, of produce the gaps or the priority areas. Yeah.
Okay.
For me, it is best if they can, produce one objective on one paper so that they can elaborate more on the process. I think it's better for them to do that. Yeah. Any comments from others? What do you think about this before we go for the discussion, the limitation, and the appraisal of the study? Okay, if no, this one is the statistical analysis that was conducted for the policy engagement just now. Only one mentioned, the rest no, it's just likely like a descriptive data only. And in the discussion and summary, they put some of highlights, key points, where the authors said that there is a need to set priorities for health research for effective fund utilization. for future potential health system research for to enhance for or to contribute better towards health system strengthening for universal health coverage and quality healthcare. Also, the author suggested that dissemination research on prioritized area with policymaker engagement could increase likelihood of research evidence integrity into policy. So they expect that more research on the prioritized area related to policymaker engagement can have more being used as into policy, government policy. So number 3, research priorities can correspond to the needs of funder and those who could benefit from research output, improve the overall credibility and potential health effect. They also mentioned that research funding not only influenced by perception and research interest, but also other factors such as what they did for the study, evidence needs, research gap and prioritized area. They highlight their study that it is important actually to have these 3 areas of criteria. And from 2011 to 2015, there were heavier emphasis on research under SD, which is service delivery. So it continues to be high importance, likely to demand number of research gaps and conversely reflective of capacity strengthening needs in other domains. And for this one, I'm not sure where the authors refer back to the data because it's not mentioned somewhere in the articles about service delivery, but they mentioned this in the discussions. I'm not really sure about this one. And also the author highlight the priority setting study is extremely complex and challenging. So from this, the author agreed that because of the number of researchers apply for the grant is large in number, but the available funding was small, so they need a way or methods to help them prioritize or highlight which of the priority setting to be selected as a research area for grant grant. So in the study also the limitation. The authors mentioned that the research project reviewed in this study only funded by NIH, and while the other grants from other sources were not included, such as from the local or international or funded through operational budget. So only the study funded by the NIH only. And also the study specifically assessed project group under the UAQH research cluster, whereby the other MOH research funding initiative were not applicable, such as environmental health, non-communicable disease and burden disease. So what I can say here is the area quite limited only under the cluster UAQH cluster. So the rest of the research project might be left behind. I'm not sure. It's not left behind. Maybe maybe for future study we can use the other funding initiative to be included as the priority to be prioritized as a project to be funded. The author also not identify the economic or capacity building benefit of NIH funded health research due to data and availability. For future study, the authors suggest that more holistic measurement of research impact. So maybe there are other better ways, to assess this impact. So this is what the study, the author suggests, and also the future exploration into degree of policymaker engagement and its benefit will be available for funders and applicants to increase impact. Okay, for the limitation, the author also stated that self-reporting and timing of impact assessment could still affect result, as self-reported data did not seem to overemphasize impact. So in this paper, actually, they didn't mention clearly why they choose, the duration, the time frame of the study. So they actually put that as limitation, and they knew that actually the study also considered all projects equally, irrespective of methodological quality, project size, and impact significant, which limit and complicates effort to draw lesson from the overall impact, which I think it is. I'm not sure to say that either it is biased or because when you do some research, you might have some criteria to make sure that all of your case selection or of your data are homogeneous, so that you can compare them secara adil lah, macam tu. So when you just consider this, I'm not sure how much we can believe the data or the outcome lah. And the last one, sorry for the R missing here, research impact assessment is still essential to build evidence to demonstrate that the return on investment of research fund. So I'm not sure either this study, the limitation of this study were adequately controlled, I'm not sure, or there is better way for us to do this, I'm not so sure. Any comments on this limitation? Prof. Cho, do you have any comments on this? Especially on the items, on the key point number 2, because they put all the project are equal, you know, to me is something we need to do something on this, you know, key points to improve the, you know, data collection maybe. No comment, yeah? Okay, maybe we go for the appraisal on the method. Okay, method of study used was mentioned in the study following 3 objectives stated in the article. But the question is the method adequately defined? I don't see any, you know, clear, it's actually there, but I'm not sure about the, you know, the sequence of the methods, either it is the correct way to do that or there is better way to do that. I'm not so sure because it's not in my field, but I appreciate that the authors did mention about the, you know, the framework or the questionnaire being used in the study is actually there, but it is, I'm not sure if there is some other better ways to do that. So in this case, only for the selection of the study, only NIH funded research that were completed and ongoing study was selected, but then they did not mention why they only choose this, although mentioned that it is, you know, limited to this study, but there is no detailed explanation on that. Also the time frame only from 2011 to 2015, which I believe is only referring to the, you know, research cluster or research area in 10-11 Malaysia plan. So the reason was not, you know, stated clearly. And then the selection of study research project was not clear to me in terms of how the researcher choose and select specific criteria of 71 studies. What can I understand is just they just, you know, select all of the project funded by NIH, rather than, you know, maybe type of the study design, or, you know, type of the what's available on their hand actually on the data in terms of the study project. And I also not sure how they classifying the research project into 5 domains. What I understand is that during the workshop they have some sort of research group, you know, interviews and questions. So I think they discuss, you know, in the groups to get the consensus agreements on the all of the classifying research project into 5 domain. Anything anyone can would like to add something on this one? What do you think about the issues, the research question identified or addressed, or the data resource? Is it enough, sufficient data resource used in this study? You want to comment? No? So if no comment, we will proceed to the other parts of the methods of data collection. So case selection, collective or multiple case study was used, which it based on the study site that is that are NIH and MOH. So I believe that the author knows well the site and can work well with the system and staff working in the selected site. But I'm not sure whether any selection bias involved here in terms of, you know, selecting, in terms of during the discussion, in terms of, you know, put opinion of the stakeholder. I'm not sure. Maybe some selection bias involved here. I'm not so sure. But this is my question arise during I read this paper. The About the response rate, yeah, the author report in the study that all of the 150 they got 100% response rate, but for the data, if you notice just now, we get 151 response back, so they are actually missing data, so I'm not sure, it is not aligned actually, response rate is not actually 100%, but I'm not sure why they tell us that it's 100%, although the result presented is 151. So any questions, comments? About the questionnaire, Prof. Chu mentioned also just now that the questionnaire used in the study either validated or indicated use in Malaysia setting. It was not mentioned, so maybe we can ask for the authors of the study. Maybe it was validated in Malaysia by other researchers. We're not sure about that. And then statistical analysis, as what Dr. Azifah mentioned just now, the one sample with constant sign run test, maybe they can produce more information about the p-value and then do something with the 150 response from the stakeholder, to produce better results. What do you think about the statistical analysis and the results? Any comments? Maybe you would like to say something in terms of the result reflecting of your decision as a researchers or as the stakeholder in terms of decision making to what area or research area that you will prioritize for the research proposal in future. Any comments on that? I think that based on this, from the selected area priority setting, as a researcher, I might use the information, some part of it, to focus on which research area could I focus for my research proposal, but it is quite limited because it's only focused on some area of study. Maybe other researcher can make use from the same field, can use this as additional information to help them to choose which area that they can focus in future. Okay, I think that's all for my presentation. If you have any comment, you can put them in the chat box, or you can ask now on the floor. Any comments? No, so far? Right. All right, no comments, so I hope that everyone can understand it well. If you have any question about this study, you can come and see me or discuss with me. Maybe I explain in a way that you can't understand well, or you can refer directly to the paper by the NIH researchers. Prof. Cho, do you have anything to add?
Okay, thank you, Sawana, for very very effortful presentation, and it has not been easy, as I learned from her. But this paper itself isn't making it easier for us. As you can tell, if you have read it, it could have been better described, and the flow of the study could have been more systematically reported, going by objective, and then going by the methods, data collection, the measurement, and then analysis. But it just seemed to be not so systematically reported. And the information given is not making anyone able to reproduce it, and we will not be able to understand it as well as required. So this is a big lesson, I think, for all. If you are reporting from any research project, you want to report it clearly. Do not take it for granted that people can understand whatever you say. Yeah, people cannot read our mind. We have to report it clearly as if we are talking to kindergarten. That's what I learned from a Nobel laureate, Whenever you explain something until the kindergarten children can understand you, then you are truly an expert and you are truly understand what is your stuff, that you can make even kindergarten children understand your concept. Okay, I think that's all from me. Sawana, thank you so much.
Thank you so much, Prof. I assume there are no comments or feedback from the floor. So I think we should end our MDH 13 here. But for now, we don't have any topics for MDH 14, right, Prof?
Yeah, so keep up. Yeah, look out for it. We'll announce it in
Yeah.
our email or
Yeah.
newsletter. Yeah.
So we are going to have our MDH 14 in 2 months' time, because now we change from once in a month to every 2 months. So please keep up with us. We will update you on emails and on the website. So for now, I shall end our session today by thanks to all of you for staying with us and always with us along the way. Yeah, that's all. And thank you.
Bye bye. Thank you.
Bye.